IBD Qorus is a multi-center collaborative network focused on improving the quality of care delivered to patients with inflammatory bowel disease. In 2018, the IBD Qorus network launched the Breakthrough Series Collaborative entitled Urgent Care 2.0. In this Breakthrough Series Collaborative, sites are challenged to improve the quality of care they deliver to patients by improving the access to care, particularly in times of urgent need, and particularly for patients who are considered at high risk.
Those that are on steroids, those with chronic pain, those with uncontrolled anxiety and depression, and most importantly, those patients that have a hard time communicating with our coordinators.
Those who have symptoms severe enough to require steroids, and those who have had recent hospitalizations.
The patient who is at risk for developing complications from their IBD, requiring hospitalizations or requiring surgery.
Those who will likely end up in the ER or OR within the next month.
How I define the high-risk IBD patient is the obvious CT scans, ER visits, frequent phone calls, narcotics, prednisone, but then also a patient who's in transition from maybe peds to adult GI, going to college, getting a job, changing insurance, having children, due to all chances of medication interruption.
Somebody who is flaring on their maintenance medications or steroids and isn't able to access medical care.
The high-risk patient in the office is the one who frequently calls or has just started on steroids or biologics. The high-risk patient coming out of the hospital for surgery or flare is by definition high risk.
Those with the coexisting diagnosis of IBS, underlying depression and anxiety, or those who frequently call the office with symptoms.
Those patients who score low on the confidence question on the one-pager about how to manage their urgent IBD need.
The patient that is not a good self-advocate and is not quite aware of how severe their disease is would benefit most from being on the high-risk patient list.
Those that maybe have difficulty navigating their care or have insurance issues that could just use a little watchful eye while they're not feeling well or starting to therapy.
Those that have failed a biologic and are currently with poorly controlled symptoms on their subsequent biologic therapy.
Patients who are frequent utilizers of the emergency department and patients who are not proactive about contacting the clinic to ask questions about how to deal with their symptoms.
I think the patients that benefit the most from being on the high-risk list are those who interact with us the most frequently. So the patients who call in with frequent questions or early at the start of symptoms of flare.
The patients that would benefit the most from being on a high-risk list would be the patients that are afraid to communicate. We know that with better communication comes better outcomes.
The patients that I'm worried that we're missing on our high-risk list are the patients that might not be going to the ER in the next month or two, but might end up in the ER in the next year or two. The patients that are not compliant, that might have coexisting anxiety or depression.
Adolescents that are working through transitioning issues into young adulthoods, those with poor or lacking social networks, and those actually that have poor access to community resources.
Patients that don't come to the clinic, either cancel their appointments or no-show. These are probably some of the highest risk patients that may not be taking their medications and may require future hospitalizations.
Patients I'm worried about missing on the high-risk list are patients who don't come in to see us in person. We generate our list based on patients who come in for visits. There are patients who are having issues on the phone. We don't have a tracking system now to get those patients added to the list.
The patients I worry about missing on the list are patients without great insurance to ensure good follow-up, or those who don't live in close proximity to an IBD center and they don't have great follow-up care locally.
A patient I saw yesterday named Michael is the perfect example of somebody we missed on the high-risk list. He disappeared for about 8 years after stopping his Remicade, and now he's coming in with obstructions and nothing we can do for him medically.
So we're worried about missing the high-risk patient who does not know to call when they're having a flare or having symptoms. But also worried about missing the patient who does call and whose care doesn't get expedited appropriately.
I'm worried that we're going to miss those patients who remain severely symptomatic but never call to let us know about it, and then show up with severe complications requiring hospitalization or surgery.
People I'd be really worried about missing on the high-risk list, we have some patients here in central Pennsylvania who are very stoic and who don't want to bother us and who will not seek out care until they're actually really sick or have abscesses. And I call them the underfeelers. I'm really worried that we would not be able to have them we'd miss them on the high-risk list as a possibility.
Some patients we're worried about that might be missing on the high-risk list are patients who may be more stoic or minimize their symptoms.
As IBD coordinators, we worry about patients falling through the cracks, particularly when they change insurances and don't communicate that appropriately.
The high-risk patients in our clinic that I worry about the most are the ones who don't have an appropriate social network of others to help support them when they're sick, and those who've had a history of missing appointments with us or who don't have resources to get the therapies we're prescribing. We certainly all know about the patients who have all the risk factors for having worse outcomes, but one that we haven't studied enough are the patients who fall through the cracks because they don't have access to care or they don't have the support network outside of the clinic to give them what they need. This is a group we really need to start focusing on.
This is Arthur Ostrov in Saratoga, home of horses, health, and history.
Hi there. Yes, you're seeing this correctly. I'm whispering and in my closet, hiding from my small children so I can do this quick video.